I am Dr. Michael Breus, and this is Win the Day with James Whittaker.
You're listening to Win the Day with James Whittaker.
What we do in life echoes in eternity.
Broadcasting from Los Angeles, California. Here's your host, James Whittaker.
Let's go!
Hey winners, welcome back to Win the Day. If this is your first time here, we sit down with some of the world's true change makers to give you all the tips, tools, and strategies to win the day every day. The quote for this episode comes from Jim Rohn and says, "Success is neither magical nor mysterious. Success is the natural consequence of consistently applying the basic fundamentals." Dr. Michael Breus is a double board certified clinical psychologist and clinical sleep specialist. As founder of SleepDoctor.com, he has established a reputation as the leading expert on the science of sleep and peak performance. Dr. Breus is a #1 best-selling author, and his books, including the smash hit The Power of When, are available all over the world. He is an expert resource for major publications and has been featured in everything from Oprah and Dr. Oz to the New York Times and the Wall Street Journal. His fifth book, Sleep, Drink, Breathe, Wellness is Too Freakin' Complicated, great title, has just been released. It offers a back-to-basics approach focusing on the 3 wellness dominos. Dr. Breus is also the first ever 3-time guest on the podcast. If you want to go and check the other episodes we did, episodes 44 and 81, he crushed it. We answered all of your questions about sleep. But in this episode, we're going into so much more. We're going to go through the most effective strategies to improve performance and overall health, why most people breathe incorrectly and how to fix it, the biggest biohack fails that are costing you money, and how to fix your sleep quality once and for all. Before we begin, the right bit of inspiration can completely change the trajectory of someone's life. So there's a friend or loved one out there who needs to hear this episode or could use some help to win the day. Share it with them right now. All right, let's win the day with my good friend, Dr. Michael J. Breus. How are you, sir? Thanks for coming on the show.
My friend. How are you? I'm the 3-time champ. I love it.
Always leading, you know, always.
I'm trying.
The first 2-time guest, the first 3-time guest.
I really appreciate your support.
Oh, well, I love all the work that you're doing.
We have a good time.
Yes, we certainly do. And obviously the response on social media is huge every single time that we get together. Most important question, the J, what does it stand for in Michael J. Breus?
Jason.
Oh, nice.
Jason. So I'm the man with 3 first names, Michael, Jason, and Breus. Breus isn't spelled like the first name, but I have that moniker.
I love it. Well, to kick things off, if someone is struggling with their health and they don't know where to start, what's the first domino that you recommend and why?
So it's a good question. I'm going to back up and I want to explain a little bit about what I think the dominoes are, just for everybody to kind of have some context. So I think wellness has gotten too fucking complicated. I mean, it just has, you know, and I have so many people, like I'm at the gym the other day, I was watching this woman and she just stopped. Like you could tell she was utterly confused at what is the next thing I'm supposed to do. And I feel like I've been going through that with a lot of those areas in my life and wellness. I have a lot of patients that come up to me and they're like literally, Michael, where do I start? Do I start drinking some green drink? Do I buy a sauna? Do I do a cold plunge? Do I spend a lot of money? And so my thought was, well, what if we could find the fundamental things or activities or processes that the body does that would be like the DNA of wellness? Like where does it all break down? Like what are the electrons and protons of wellness, right? And so then I said to myself, well, what are some of the things that we have to do every single day? I know the world's record for staying awake is held by a guy named Rudy Gardner. He was up for 11 days. Okay. By day 7, he began to hallucinate. By day 10, he wouldn't even respond. Like he was just kind of sitting there, like looking, and he had caffeine in him. Terrible idea, right? So we know we need to sleep. There's only so far we can get without that. Hydration. Hydration is interesting. I think about the longest somebody could go, and by the way, nobody should do this, is like 3 days, right? Without water. And bad stuff starts to happen very, very quickly when you do that. So that's felt fundamental. And then there's just air, right? You know, it's like, it seems like one of those things. Like I figured everybody should be doing it correctly. And then I started to look into it. It's kind of crazy. You realize if you go back into like Indian yogic, all the, like Ayurveda, all this really amazing, cool stuff, like they've been doing different breathing techniques for energy, for sleep, for all these different things for years. So then I was like, oh, I think we all might be breathing wrong. So to answer your question, I want us to hit all three, but there is an order in which to hit them. I like to start with sleep. I feel sleep becomes so important. And it's just, by the way, an itty bitty teeny tiny bit above hydration and breathing, because when you don't sleep, you automatically become dehydrated. And when you don't sleep, you overbreathe. And so that has a direct effect on those two processes that it's difficult to kind of dial back. So I think you start with sleep. Now, here's the thing. A lot of people, there's some basic sleep problems out there that people have. I'm not talking about sleep disorders, right? I'm talking about like apnea or narcolepsy or insomnia, which, by the way, we have spoken about here on this podcast on numerous occasions. I'm talking more about things like people just saying to themselves, hey, I think my sleep problem's just going to go away on its own. Okay. Like that shit doesn't happen. Okay. Like once you wander your way into some sleeping difficulty, generally speaking, it almost never just immediately dissipates. Generally speaking, it has a tendency to get worse or move into a direction that makes it much more difficult to treat. So for me, what I tell people is, look, there's some fundamental things that you should do. Number one, know your chronotype. We've talked about chronotype many times and the importance of that. To give people context, chronotype is your internal genetic predisposition for sleep. And that then controls a whole bunch of other things in your hormones. And when you got an idea of when your hormones are at particular levels, if you schedule those activities at those levels, all of a sudden you do that activity better. Now, to be fair, most people like to know about sexual activity. So we'll talk about that at some point in time in the pod. But once you kind of get this idea set around activity together, it works well. And chronotypes help you get there. Within chronotypes, you actually have an assigned sleep time, when to go to bed and when to wake up. And it's genetic. So it's very, very specific. So what's great about this is if you learn your chronotype, which go to chronoquiz.com, then all of a sudden you now know what time to go to bed and what time to wake up. That makes everything so much easier for everything else that you're trying to do. But it kind of gives you the guide rails from which to go. So I like people to start there by learning their chronotype and getting those guide rails.
If you're at a dinner party and you want someone to figure out what their chronotype is very quickly, do you have a few questions you can ask where you can, 80 or 90% accuracy?
Absolutely. So, well, number one, oftentimes I just say, whip out your phone and go to chronoquiz.com. But if I'm just going to ask them, here's what I tell people is I say, if you went on a 2-week vacation, which I know is rare these days, but if you did, or if you went on the end of your first of your 1-week vacation and you were allowed to go to bed and wake up at whatever time you wanted, what would it be? And that usually gives me an idea, because the first few days of vacation, you're just kind of catching back up, kind of getting the battery, to revive itself. But towards the end of the first week of the vacation, if you just really let your body sit and do what it wants to do, you'll settle into something. Now, the second question I ask people is, what were your mom and dad like? Right? I don't know about you, but when I was young, if I walked into my parents' bedroom at 11:30, 12 o'clock at night, they were both wide awake. My dad was watching TV. My mom was reading something. Everybody was a night owl. Surprise, surprise. I'm a night owl, what I call a wolf. So you can look at your parents for that one. The other one, the final one is, don't forget that this will change over time. So a lot of people say to me as they say, hey, when I got out of college, I was a lion. I was ready to get up at 6:30. And now, man, Michael, I am dragging it and I don't know what. So, right, it changes over time. And so what I ask people is I say, was there a time in your life where you felt like you could get up and it kind of worked with your current schedule? And is now that time, or is it different now? Because if it's different now, then there's a mismatch. And that's where we can do some good by kind of scooching people in one direction or the other.
Yeah, being a parent shifted me from wolf to bear.
Oh, so let's talk about that. So being a parent is bizarre, number one. Like, I wish they came with instruction manuals. Like, honestly, it would be so much easier. Their sleep is kind of kooky and crazy as well. But being a parent, you have to layer on sleep deprivation on top of this. I always tell the story that when my wife, we had our second child, I was so sleep deprived. I'm the sleep doctor, right? I should know what I'm doing, right? So I was so sleep deprived that she had breast milk that was in the fridge. And she was like, Michael, can you go get the milk in the fridge? Yeah, sure. So I go and I open up the linen closet. Okay. And I yelled, I'm like, Lauren, there's no milk in here. And why are the sheets in the freezer? Like, I was dead serious. Like, I could not have been more serious if I tried. But that level of sleep deprivation really enhances everything. And so as a parent, you all of a sudden, now you've got this kind of layer of like grogginess that goes throughout your day. And you start to learn things like, oh, my kids go to bed at certain times, at different ages. So when they're itty bitties, right, they go to bed at 7, maybe they wake up at 7 in the morning, but you have a 13-year-old, that's a whole different ballgame, right? They're going to bed at 2, right? They're waking up at 12, 1, and Monday mornings are so difficult with teenagers. So there's a lot of stuff to kind of get through. What's nice about the book with Sleep, Drink, Breathe is the program is one that you can actually introduce to the entire family, which is kind of one way I like to do it, is kind of get everybody in the morning, because most people, the whole family kind of has to get up at roughly the same time for work and school and things like that. Maybe you let the teenagers sleep a little bit longer and the toddlers or the middle schoolers get up a little bit earlier. But generally speaking, that's what you do. But you could actually get them involved in the whole program and it would work really well.
I love it. We had Rich Davini, Navy SEAL commander, who came on the show. He mentioned that he can fall asleep underwater, which is crazy, right? I assume he had some type of diving apparatus on.
I would hope so.
Yet there are other people who can't fall asleep in an extremely comfortable bed.
Right.
Why is there such a big discrepancy? Like, how can...
It's a great question.
Yeah.
So I would argue it's mostly anxiety, right? Especially like if you took that person who says they can only fall, it's like Princess and the Pea, right? They can only fall asleep in this perfect environment. Look at them earlier in their life. My guess is they could fall asleep just about anywhere, but something happened over the course of time that instilled a fear. Because I think that's, if we're really breaking it down to what do we think is really going on here for folks like that, I think it's a fear of safety, right? So at the end of the day, if you're going to be asleep, it's the most vulnerable position you could possibly be in, right? Your eyes are closed, you're completely defenseless. There's no way to react with any type of quickness. So you have to feel safe in your environment. So if Rich felt safe underwater, he could sleep underwater, assuming he has air and all that kind of good stuff, right? But if I have a patient who comes to me who can't, usually I start looking around for where's the safety issue. Sometimes we have them get an animal. Seems to work well. Get an alarm system. Seems to work well. Buy a firearm. Seems to work well. Like those are some of the things that people can do. But then the question really becomes is like, what is the fear? And sometimes it's not a fear of physical safety. Sometimes it's a fear of, let's say, financial safety or relationship safety, right? Like there's a whole host of things that'll keep somebody awake when they get in the bed at the night. And most of the time, it's usually not the mattress and the pillow. But I do agree a good mattress and a good pillow is super duper important. That's one easy way to really help with your sleep. I tell people all the time is like, hey, throw some dollars at a mattress and a pillow. Like, let's be fair. It's the piece of furniture you're on more and longer than anything else in your entire house. If you put a few bucks towards anything, like it doesn't need to be the next big screen, it should probably be your bed.
And creating emotional safety in a relationship is very, very important. So if someone is in bed with a spouse where maybe they're not getting the emotional safety that they want from their relationship, and sometimes when it comes to anxiety, we're not even consciously aware of these anxiety feelings that can creep up.
Of course.
So how does someone who is in a situation where they just all of a sudden they have the fidgety legs or they just feel quite overwhelmed and anxious in the middle of the night, what can they do to make sure they can improve their sleep quality?
So distraction is probably one of the best techniques out there, right? Lots of different ways to distract yourself. The most common, television, watching TV to fall asleep. Just so that everybody out there knows, my wife falls asleep with the television on every single night. TV is on all night long, usually, and I'm the sleep doctor, okay? So it all depends upon what you can adapt to and what works for you. For her, she's watching an old episode of Seinfeld because it's just enough to keep her attention away from what she calls monkey mind, right? Which is like going over what happened today, what's going on with my son, what's going on with my daughter, what's going on with this. Those are things that you should think about or talk about earlier in the day. It's really not a good idea. Number one, you're not going to solve the problem, right, as you're falling asleep. But here's the issue. It's the only time of day that you have any time to yourself usually. So oftentimes what I'm asking people to do is, hey, can you take a break after dinner for 15 minutes and just jot down like a worry journal? Like, here are the things that I usually think about right before bed. I'm going to come up with one little solution. It might not solve the problem. Like, okay, something's going on with my son. I might not solve the problem, but I'm going to write down, talk to Cooper at 10 o'clock tomorrow morning. That's just a step in the right direction. It lowers my anxiety, allows me to now go to bed, not necessarily with a bunch of to-dos on my brain, right? So that's one way, is kind of clear that brain space. Other things to do is flat out distraction techniques. One of my favorites is to count backwards from 300 by threes. Try that for a second. Okay. 300, 297, 294, 291, 288, right? It's mathematically so complicated, you can't think of anything else. And it's so damn boring. You're out like a light. Okay. So like those are the kind of things. Another one of my favorites, and this is one I talk about quite a bit in the book, is called 4-7-8 breathing. Right? Now, you've heard of this technique before. Andrew Weil, super smart dude, developed this for the Navy SEALs. We seem to be on a Navy SEAL kick, where it was to slow their heart rate down while they were shooting downrange. So if a Navy SEAL is shooting downrange, if their heart is beating too fast, it can change the trajectory of the bullet. So if you slow their heart rate down, then they can shoot in between heartbeats. That was the initial goal of creating the technique. Lucky for us, it lowers your heart rate down so damn low that it helps you fall asleep. So it's very simple. Breathe in for a count of 4, hold for a count of 7, breathe out for a count of 8. Now, at first, it's not so easy to do this. So what I tell people is try the 4-5-6 version first, and then graduate to the 4-7-8 over time. But that's one of the breathing techniques that I talk about in the book, and how we can utilize breath. Like, here's a perfect example of how do we utilize breath to activate the parasympathetic nervous system to help calm us down and relax us before bed.
You know, the time I have the most trouble sleeping is when I have an early morning commitment. Flight as well, absolutely. Something that if your alarm were to not go off, it would be a big problem. So if I've got a speaking event that might be at 6 a.m. or just anything important that depends on me waking up when my alarm goes off, I find that by far it's the most disruptive sleep. It's like I cannot get into deep sleep.
So I wish I had a great hack for that one.
Click your fingers and give me a solution.
It doesn't. Everybody I know that happens to. Yeah. Every single person that I know. Some of the best sleep doctors in the world, they'll report that as well.
Just means you care about it, I guess. That you've got something important.
I think the big idea set here is don't be stupid and do stuff that would make it worse, right? Like if you know that you've got a big thing to do tomorrow, don't have caffeine late in the day. Like, come on, don't take a nap at 3 o'clock. Right? Don't do things that will self-sabotage your ability to sleep that evening, but be forewarned, it's probably not going to be good. Now, here is one piece of advice I can give you. Don't go to bed early. That's something that a lot of people will do. They'll be like, oh, I know I don't sleep well the night before a flight, so I'm going to get in bed early. There's this thing called your circadian rhythm, and it tells you when to go to bed. Like we were talking about the chronotypes before, same thing. So don't go to bed early on those nights before. Actually, I'd go to bed a half an hour later, because what that does is it gives you a little bit of buildup of sleep deprivation to maybe help you catch a few Z's.
And speaking of sleeping on a plane, have you got a good strategy for being able to sleep on a plane?
I do.
Apart from getting a first class ticket rather than economy?
Yes. Well, first class is always the best way to go. So it's kind of interesting. Actually, you can use all three techniques, the sleep, the drink, and the breathe on an airline. And so there's a lot of fun ways to do that. So number one, sleeping on an airplane, it has a lot to do with seat choice. So first thing you should do, there's a website called seatguru.com. I love it. It gives you a red light, yellow light, green light. They want you to basically stay away from the areas of high congestion, right? So bathrooms, the galley, the kitchen, what have you. It's always going to be noisier. Depending upon your size, I'm only 5'9", so window seats work great for me because I can lean my head against the fuselage to fall asleep. But generally speaking, I don't like to sleep on most airplanes if I can avoid it. Now, if it's an overnight flight, then sure, I try to avoid those if I possibly can. Or I use something called Time Shifter, which is an app that I have. I think I've told you about it before. It's really cool. It's a scheduling app that tells you when to use caffeine, melatonin, light, and napping in a particular order to get you to your destination with almost no jet lag. So I utilize that if I'm having a long flight. The other things that I do is I bring my own sleep kit. So I don't rely on the airlines because quite honestly, they don't give you all the good stuff. So I have my own really good sleep mask. I have my own meditation music on my, headphones. Also, I watch what I eat. That's another big thing that I do on airplanes. So I stay away from carbonated beverages because it'll give you gas, make you feel uncomfortable, which can make, have bathroom trips and things like that, which can be disruptive if you're trying to sleep. The other biggie is, and I know people aren't going to like this, but I avoid alcohol on the airplane. Like one drink in the air, I think is worth two on the ground. And so here's the thing is, people get hammered on the plane. They have no idea that they are, and they stand up and all of a sudden they have a problem on their hands. Also, remember that the sleep that you get that's alcohol induced is not really great sleep to begin with. So what I would say is if you're a nervous flyer and a glass of champagne is something that settles you down, I think I'm fine with that, but I wouldn't have a half a bottle. That's probably not going to be good for you. On the drinking side of things, though, hydration is definitely key. And people don't realize it, but you get super duper dehydrated on an airplane, especially long flights. I try to put in maybe 7 or 8 ounces per 2 hours of flying time. So as an example, if it's a short flight, if it's 3 hours, then, okay, I'm going to try to get maybe an extra 20 ounces of water in my body. Yeah, I might have to go to the bathroom while I'm on the plane, but I can also wait till the end and make sure that I kind of load up, depending upon what time of day it is. I'll definitely try to get that in. And then as far as breathing is concerned, I like to do 4-7-8 breathing when we fly. It keeps me pretty calm and relaxed. And usually, to be honest with you, I end up teaching it to the people that are sitting next to me because they're like, what are you doing? And I'm like, I'm doing this breathing thing. You want to check it out? And so I teach it to them and they're like, oh, this really works. I feel really calm and relaxed. It's good for flight anxiety too. If anybody out there has any flight anxiety. So yeah, you can sleep, drink, breathe your way to a good trip.
Yeah, I don't book a single flight without looking at seatguru.com. It's great. And an eye mask, a good comfortable eye mask, because you don't want to be banking on it and then to find out that the flight for whatever reason hasn't packed it. And then noise cancelling headphones and a window seat, all of the stuff that you just mentioned. I feel like if you've got that, then you're going to be in a pretty good good place.
Bring your own food. Like snacks wise, because again, you know what your stomach can handle and what it can't. And so a lot of times I'll tell people like, I get it. Like, even if you're in first class and you're like, Yahoo, like you might bring your own snacks. You might be surprised. You might not like some stuff that's up there.
We'll be back with the show shortly. I've got a quick question for you. Are you living up to your potential? It's a question that shapes your family, your business, and your overall happiness every single day. That's why I'm excited to introduce the Win the Day quiz. Head over to winthedayquiz.com right now, answer a few thought-provoking questions, and you'll instantly discover how well you're performing relative to your true potential. And here's the exciting part for our Win the Day family. As a fan of the show, you'll receive a personalized and absolutely free action plan to help you win the day every day. Now, just imagine how transformational the results will be when you consistently show up as the best version of yourself in every aspect of your life. Don't miss out. Take the Win the Day quiz now by visiting winthedayquiz.com or click the link in the show notes. All right, let's get back to the show.
How can a shift worker improve their sleep quality when they have such an unpredictable routine?
So it's really, really hard. Shift work is one of the toughest things that I deal with on a somewhat regular basis. And to be honest with you, they're actually specialists in sleep that only do shift work. And so when you're a shift worker, the key factor is to avoid any of the outside irritants, as I call them. So again, understanding when you're drinking coffee, when you're having alcohol. Light turns out to be a big function for a lot of these shift workers because they're sleeping during the day and working at night. So they have to utilize light at night to keep them awake, and then no light during the day to help them sleep. To be very honest with you, the best thing that a shift worker can do is get off the night shift. The data is incredible. Higher suicidality, higher depression, higher anxiety. I get it. It's more pay. It's usually double. And that's why people usually do the night shift, is because it's double pay. I will tell you, though, if your chronotype is a wolf, like a night owl, it's actually not that bad. So one of the things that people always wonder, because I'm a night owl, is that why I got interested in sleep? No, but it certainly didn't hurt because I didn't mind being up at 2 or 3 o'clock in the morning, playing around with electrodes and kind of seeing what was going on. So I think that sometimes people will kind of find their way into shift work who are night people. And so that oftentimes that can work well. But to be honest with you, if you're a lion, like we were discussing an early bird, and you're trying to, stay up late, it's going to be really hard to do that.
If you're someone who manages stress quite effectively, would that make a big difference? So if you're a shift worker who's better at managing stress, you'll be healthier?
Yes, I would absolutely agree with that. And I would argue that stress is probably the biggest factor that a lot of shift workers have, other than like the problems with their job, like, some issue comes up with my job, that's an issue. But I mean, it's just the management of stress, and it's different kinds of stress. It's like stress about not knowing what's going on with your family, right? Like they're all asleep while you're awake and you're asleep while they're awake 9 times out of 10. So you have to be very good with handling stress.
How do you feel about melatonin supplementation? And does that reduce your body's ability to produce it naturally?
So 2 separate questions. So let's answer the second question first. So the good news is you can take as much melatonin as you want and your body is not going to stop producing it. We used to think it was similar to testosterone in men, where with men, if you start taking external testosterone, your body just stops making it. And so then you're on it forever. Not the case with melatonin. However, most people don't need melatonin. Most people don't realize that melatonin is only good for shift workers, like we were talking about, jet lag, something called REM behavior disorder, where you act out your dreams, and in some cases, ADD, ADHD, and then people with a melatonin deficiency, which, by the way, is a very small number of people. However, here's the big thing that most people have no idea. Melatonin affects birth control. It affects blood pressure meds. It affects diabetes medication, and it affects antidepressant medication. If I was on any one of those medications, I would have no idea, because the medications don't talk about it and melatonin labels don't usually talk about it. So if you're taking any one of those 4 classes of drugs and taking melatonin at night, you are easily affecting that negatively, so that you're making the medication less effective, which means you have to escalate dosage. And now you have a secondary problem on your hands. You got too much going in. So melatonin, in many cases, I would argue, is not appropriate. However, man, it's popular. Holy cow, it's everywhere. And by the way, the dosages that you can find it in, it's all in an overdosage format. The correct dose is between 0.5 and 1.5 milligrams. Dude, you can't find gummies that are smaller than 3 milligrams, 5, 6, 10 milligrams. And so what happens is somebody grabs a 10 milligram gummy, they down it, right? And they start getting really vivid dreams. That's one of the side effects of overdose of melatonin, is extremely vivid dreams or nightmares. So the bigger thing to remember is melatonin is a sleep regulator, not a sleep initiator. So melatonin is not like a sleeping pill. It doesn't make you fall asleep. It makes your brain think it's bedtime. So that's very different. So let me give you another example of where you have 2 differences like that. That's like saying that appetite is the same as lunchtime, right? It's not. Appetite is that thing that grows in you and makes you want to eat. Lunchtime is that time of day when you usually eat lunch. That's actually how melatonin affects the time of day. It does not affect that initial initiation.
Have you looked at or studied the placebo or nocebo effect at all in sleep?
Oh, absolutely, I have. It is rampant. It is unbelievable. Boy, I wish I could get half of the crap that's out there working as good as placebo. It's just such a huge problem. Every time I go on social media, I am bombarded with sleep junk. I mean, everybody's got a sleep supplement. Everybody's got a sleep supplement. And here's the thing. And this is a good thing for people out there to think about. So if you want to win the day when you're thinking about getting a sleep supplement, you need to really look at the science, because here's what people are saying now, and it's trickery. What people are saying is they're saying clinically studied ingredients. Okay. When you see that, big red flag should go up, because what that means is each individual ingredient may have been studied 20 years ago by somebody. Does not mean that the company that is making that supplement tested that ingredient. That's number 1. Number 2, when you see that the data has been published in a journal, go find it. 9 times out of 10, what you will discover is it's either a pay-for-play journal, which is in science, you can actually pay somebody to publish your papers. That is a thing, but the general public has no idea, because these journals have these very journal-sounding names, like the Journal of International blah-de-blah, and you think, oh my gosh, that sounds fantastic. It must be real.
Very legit. Yeah.
Right. And all you do is you pay them $2,000, and guess what? Your paper gets published. So see where it's being see where the paper is being published. And then the other thing is read the science. Like if there's only one paper out there that shows that magnesium helps with sleep, magnesium probably doesn't help with sleep. The good news is there's a lot of papers out there about magnesium sleep, and so it probably does. But you see what I'm saying is people need to be, unfortunately, your own scientist. And anytime that you see something that's got more than 3 ingredients in it, it's what I call the kitchen sink. It's let's just throw everything in that we can possibly imagine and hope it works. And that, I think, is another form of placebo, if you will. It's kind of the opposite. It's like the everything's placebo, you know? It's like, let's just throw it all in there and see what happens. Also, I think people just want stuff to work. You know, at the end of the day, people are tired. And
you can't sleep. It has such big ramifications for every other part of your life.
Dude, and also...
As you have told me many times as well, people will always come back for sleep quality because,
I had a patient tell me that they'd give up their heroin faster than they'd give up their Ambien. Like, no shit. Like, this is real, you know? And I mean, that's what's so interesting about it is when you start to look at it. And I think people are looking for answers. Look, the number one thing that people do to get themselves to sleep at night is drink alcohol. Gosh, I couldn't think of a worse thing to do. I'd rather you use cannabis than use alcohol for sleep. Now, let's be fair, okay? So people always ask, cannabis, oh my God, I can't believe you'd say something like that, Michael. Well, let's think about this for a second. If we think, or at least I think, that a large part of insomnia and difficulty falling asleep has to do with anxiety, right? I know there's a substance out there that's becoming legal rather quickly that definitely seems to help people with anxiety, which is cannabis. However, when you go to high THC levels, it does the opposite. It actually makes people anxious. So we don't want to have something that would have a high THC level to it. We also know that there's a substance called CBN, which is actually oxidized THC, which seems to have actually shown in the data to reduce arousals at night. That means awakenings. Right. So if we had something with a little bit of THC to lower your anxiety, a little bit of CBN to be able to lower the number of awakenings, and I stuck you on a schedule, that might actually work. When I go into dispensaries now here in California, I ask them, I say, what are the categories of people that come in? They said, oh, that's easy. There's only 3 types of people that come through the door: recreation, pain, and sleep. That's it. That's what's in here. So I get it. And I don't think there's anything wrong with this. Let's be fair. It's a stressed out kind of world. Now, I am not suggesting smoke pot to relieve all your stress, but I am saying that there is a medicinal aspect to cannabis that, you know, there are lots of people out there on anxiety medications, which, by the way, are highly addictive, don't really work very well and can kind of mess people up. I think I just read a study that showed that daily cannabis use just surpassed daily alcohol use. So, you know, the horse is out of the barn on this one, right? Like, society is there. And so I think we need to be thoughtful about how we don't want to stone ourselves to sleep, just like we don't want to pass out from alcohol. But it's okay to have a glass of wine to reduce your anxiety a little bit. Have a glass of water with it, please. Wait an hour and then fall asleep. With cannabis, I think you could do something quite similar and have it be effective.
One of the most interesting things I've ever heard is when you told me that sleep is recovery. And if you don't do anything to recover from, you're not going to sleep particularly well.
Right.
So people should try going to the gym first. Go do some exercise first.
And it's a natural stress reliever, right? And so you've hit upon what I would argue is probably one of the biggest sleep mistakes, which is not doing anything. If you lead a very sedentary life, you've already kind of used up your sleep quota, you know, like get off your ass, like get going. You'd be shocked at how just having a little bit more light exposure in your life and movement in your life can really make a big positive change and reduce your stress.
You mentioned magnesium earlier. There seems to be so many different types of magnesium.
11.
Give it 11 different types of magnesium. Can you give us the truth about which magnesium is effective? And is there, obviously don't go through all the 11, but is there a ranking in terms of what magnesium is most beneficial for people?
Absolutely. I'm glad you asked. So just to let everybody know, and you don't have to write all this down, swing on over to sleepdoctor.com. We have articles on magnesium, teaches you everything. But here's the bottom line. There are 11 different types of magnesium out there. I just completed a study, not in a pay-for-play journal, I want to be clear, where we actually published in an international journal looking at magnesium for sleep. Now, this was a very particular magnesium product. So everybody's going to say, like, which magnesium is it? Tell us, Michael. It was not one that is actually out on the market. It is actually a combination of several products that they use to create what they called a absorbable nano magnesium. Now, here's what's interesting. The company's called Upgraded Magnesium. I take this every single day. I've noticed several different things. Number one, bowel movements are definitely much better, generally speaking, and more frequent. Sleep is definitely relaxing and deeper. My wife has tried it and she likes it as well. That doesn't help anybody out there unless you're going out and buying the upgraded magnesium. If you're going to start with magnesium, here's where I say you want to do it. Start with magnesium glycinate. Magnesium, it's easiest on the stomach. That way we don't overdo anything. You want to have a reasonable dose, 250 milligrams. Okay. That's a reasonable dose for women. For men, you could actually have 350 if you happen to be a little bit bigger guy. Here's what's interesting mostly about magnesium. If you work out, you blow through your magnesium and your body doesn't produce it. So you have to eat it, which means you have to have a fairly high magnesium rich diet, which is lots of leafy greens. You have to eat meat, all these different things. So to be honest with you, most people should probably consider supplementation of magnesium. And I don't say that lightly, like I'm not this big, oh, everybody's got to take 1 million pills a day crap, because I usually don't feel that way. Magnesium's a little bit on the different side because it functions in so many other different areas of our life. And I just did this study, which actually showed that magnesium helped, whatever the absorption rate and is that you want. Starting with glycinate at 250 milligrams, maybe move to 350. Then I'll do a half and half combination of glycinate and citrate if I find that the glycinate just doesn't seem to be kind of kicking them over the edge. There is a product out there. It's called Calm, C-A-L-M. It's a powder. My patients seem to love it. So I don't think I have a huge problem with that. I think that is a combination of the two. I will tell you, there was at one point in time a lot of people running around saying magnesium threonate was the biggie. And you may look and find that I said it as well. We've dove back into that data and the data didn't hold up. So I don't think magnesium threonate has got any real substantial data behind it to be able to say, hey, that's the one for sleep. So again, what I tell people to do is you want one that's got a high absorption rate, start out with maybe glycinate, add some citrate to it. And if you have a super sweaty day, add 100 milligrams to that day. Now, one of the things I talk about in the book under the drink section is adding powders to your water, like what we call hydration multipliers. There's Liquid IV, LMNT. There's a bunch of them out there. Okay. So people should also be thoughtful about those because that can actually change your hydration and they might actually be useful to utilize in some cases. I don't think you should use those powders every day. I don't think you need them, but on days when you're going to be super sweaty, when you're adding that extra magnesium that I was just talking about, I think those are the days that you should use those types of powders. To be fair, they're mostly salt. And so you want to be careful about how much salt you're actually sticking into your body. I wouldn't go over about 500 milligrams. That's probably about as much as you really want on a super hot day that you're going hiking, right? But like if you're just going for your normal run, you don't need to put any electrolytes in your water. But if you're doing your long run for the week, I would advise it. Like that's how I would start to think about utilizing them. It's not an everyday thing, and a lot of them contain magnesium, so that can be helpful as well.
Yeah, I saw electrolytes as a big feature in your book, and I looked at the ingredients a long time ago that a lot of these things had, and I'm like, what do I need natural flavors in these things if I'm having it? And obviously, a lot of these natural flavors aren't natural flavors. It's a bit of a marketing term. So it was, and I was thinking about where did I initially create this homemade electrolyte drink that I have, and it was from you. So what I have most mornings now, which is great, is like a bit of an appetite suppressant if I just want to get straight into work without having to worry about food and all of that. So I have a little pinch of Celtic sea salt. Yep. I have filtered water, a squeeze of lemon juice. I put in a little bit of apple cider vinegar as well. Perfect. And if it's a training day, creatine monohydrate.
Yep, I'm a big creatine person.
Oh, you're good. We could chat about that next, actually. That'd be interesting. So I have that about 4 hours before I then go and do the gym session. Right. Because I heard that creatine is also good to give you a bit of extra energy during a day if you're a little bit tired.
It does. So I'm a fan of creatine monohydrate. Here's the good news. You can take it whenever you want. You don't have to take it 4 hours before. But your morning drink is perfect because basically you made your own electrolyte juice. If you really are dying for some extra electrolytes, like let's say you're having a heavy lift day or a long cardio day, throw a half a banana in there with you, right? Just eat a half a banana and you'll be fine with your drink. Like that would be perfect for you if that's kind of what you're going for. Generally speaking, creatine, most people should be actually on it at this point in time. All it does is it helps hydrate your muscles a little bit better, which gives them more to work with when you're working out. It also can give people a little bit more energy. Generally speaking, we look at about 5 grams per day, little scooper that you just toss into your smoothie or your drink or whatever. It's different than BCAAs, so branch chain amino acids, which a lot of people like to take. That's something you should take pre-workout versus creatine monohydrate. You can take it anytime. Many people wonder, should I take it on days off? The answer is yes, you should take it every day. One more thing about creatine monohydrate is if you have any kidney dysfunction, you should not be on it.
Do you want to tell us more about that? So I had read something. There was a study that was talking recently about energy and creatine monohydrate, that having that can help you particularly if you're feeling low on sleep. And someone had reached out and emailed me and said yes, because of that exact reason.
So what it appears to do is if you have highly good functioning kidneys, it works quite well. The problem is if you have any form of kidney disease, right? So creatine monohydrate does put the kidneys on task, makes them work, not in a bad way, but just the data would suggest that if you have any form of kidney problems, creatine is probably not a great idea, or talk with your doctor.
Sounds good. And what about sleeping pills? Like, what is a situation where you would prescribe sleeping pills? And are they effective, a good thing for people to do?
So here's what I'm going to tell you is I don't think we can say they're good or they're bad. I think there are people in this world who need a pill to sleep. I don't think there's anything wrong with that. I think they're overprescribed. I think too many people use it as a crutch and are not using it appropriately. Let me give you a few examples. So number one, when we're looking at sleeping pills in general, the problem is there's so many different types. There's what are called the benzodiazepines. Then there are the non-benzodiazepine hypnotics, which is like basically newer technology. When you talk to doctors don't like to prescribe sleeping pills. Why? Because patients become addicted to them. Now, there's a big argument within the literature of, is it a physiological addiction or is it a psychological addiction? I don't think it matters. Here's the bottom line. If I give you a pill and you haven't slept well in 20 years and you sleep well, you're going to want that pill again and again and again, whether your body tissue is addicted to it or not, right? So if that's the case, then we need to be thoughtful in how we utilize these compounds. If people have the ability to learn how to sleep without them, then that is the direction that we should take them. However, if you're a paranoid schizophrenic and you need a pill to fall asleep every night, I'm just fine with that, right? So severe mental health issues, severe pain issues, severe medical issues, all of those are ripe areas for appropriate use of sleeping tablets, whatever one you want. I would argue you want to use the latest, greatest technology if you can. Most doctors, if they're going to prescribe something, actually like to start with something called a sedating antidepressant, like trazodone or Remeron, which are two medications that are not highly addictive, but do make people feel very sleepy. So folks out there could easily be prescribed one of those. Not a bad thing to be on. By the way, they're not addictive and you can be on them for extended periods of time. So it's not the worst spot to be in. But I only really like to use pills to kind of break the cycle of insomnia. And I will tell you, you have to have people on them for about 90 to 120 days. So you're talking 3 or 4 months to just get them in a cycle where they're doing well. And then usually during the last 30 to 45 days, we start to slowly taper the medication while giving them very specific guidelines on sleep scheduling, on sleep hygiene, on sleep bedtime routines. So that way, when they get to the point where we have them off the drug, they're sleeping naturally. That is the perfect process for somebody, especially when somebody's in a spiral for bad sleep. Because here's the problem. When somebody's only getting 3 hours of sleep a night, there's not much you can do with them. You literally have to sedate them to get them to sleep.
Which is very different than someone rocking up to a pharmacy by themselves and getting all of this sleeping pills and then becoming addicted to that, increasing dosage and all of those problems.
Right. And don't forget there's over-the-counter stuff that's out there here, at least in the United States. We have a ton of that where you can buy any PM medication, Advil PM, Tylenol PM, which has this sleep component added to it, which, by the way, a little factoid that you may not want to know, all of those PMs use something called diphenhydramine. So that's Benadryl. And there is now data to directly show that there is a correlation between nightly use of Benadryl for approximately 3 years and dementia and Alzheimer's.
Wow.
Right. So this is just not what you need to be doing. If you are going to the drugstore and having to buy a pill to help you sleep, not through a doctor, you probably want to talk to a doctor, maybe talk to a psychologist. Actually, the World Health Organization recommends behavioral therapy before medication in most cases. So there's a lot of trained people out there who can do this, and I think they can do it well. And it's not as bad as you think. Like, people come to me and they're like, don't take away my coffee, don't take away my wine. And I'm like, I don't think I'm going to, right? Like, it's not horrible. It's just, let's be thoughtful. Like, if you want to have a glass of wine with dinner, I don't care. But don't have 4 and have the last one be 30 minutes before you go to bed, right? Like, come on.
Yeah, minor behavior modifications can make a massive difference to where you want to end up.
Exactly. Caffeine. Yeah. I understand that you feel like your energy is low at 4:00 in the afternoon. Don't have a Red Bull and think that you're going to bed before 2 a.m. because you're not. Like, just be thoughtful. And again, these small behavior modifications. Yeah. I'm not saying don't drink Red Bull or don't have wine.
I like the way you said be thoughtful rather than don't be an idiot. It was good. It was a nice positive spin.
Trying.
Is there a way for someone who is very tired or who has a draining period coming up, is there a way for them to catch up on sleep fast or pre-charge for
I know. Wouldn't that be great? It would be like pre-gaming for sleep, right?
Like charging your body like a Tesla for a big opportunity coming up.
Right. So you can and you can't. So here's what I can tell you is you can make it so that you don't have a whole lot of sleep deprivation on board, which means having a regular schedule and things like that. But the best thing that you can do if you know you're going to tie one on and have a big night and go to a concert and all of those things, and this is going to sound awful, but it's the truth, is have really solid sleep before, right? And solid sleep afterwards. And so it's much easier for your body to bounce back from one bad night than it is when you've had 6 bad nights in a row and then you add another bad night to it. So I would argue, go out, have fun, enjoy your life, go to that Steve Aoki concert at midnight till 4:00 in the morning. I think it's awesome. Get home, do what you need to do, and kick back into your schedule. You'll be surprised at, if you have a decent schedule going in, how much easier it is.
Are there really people out there who can survive and thrive on 4 hours of sleep?
So there, believe it or not, genetically speaking, there is a group of people called short sleepers, and they can survive on about 3 to 4 hours. However, these are few and far between. I don't think there's a whole lot of these people out there. There are a lot of people who claim to be short sleepers, but at the end, it usually catches up to them. So I would argue no. I would say nobody out there honestly should be getting less than 6 hours of sleep a night, ever.
And hydration is another big part of the book. It's one of the big dominoes you talk about for wellness. You have a statistic, 75% of Americans are chronically dehydrated. That is crazy. First of all, how is that even possible? And then my second question was it really, were our ancestors really getting, is it realistic that they were getting 8 glasses of water a day back in the day?
So number one, they had very different bodies than we do. They had very different things going in their bodies than we do. So the good news is that they actually got almost probably more water than we did. If you think about the food that they ate and the way that they ate it and the amounts that they ate, they actually did quite well back then. Now, the question becomes, 75% of America is dehydrated. Like, how did you come up with something like that? So number one, it was a water survey that was done based on asking people about how much they drink and then looking at their ages or the amount of water that we think they should be getting. And so that particular study looked at getting roughly 8 glasses of 8 ounces of water, or 64 ounces. Now, I want to be clear about something. When you start to dive into this literature, there are so many different recommendations. It's insane. In the military, they recommend over 100 ounces a day. In some different countries, it's like down to like 60 ounces a day or 40 ounces a day. So it's very different, and it depends on a lot of different things. It can depend on your age, can depend on your gender, can depend on your country, can depend on the humidity in the air. It can depend upon your diet. I mean, it just like goes on and on and on. So the goal here is to look at people and to say, what's the easiest way for me to tell if I'm dehydrated or not? Okay, it's the super easy way. Is look down when you pee. Okay, look in the toilet bowl and look at it. And if it's a faint light yellow, you're hydrated. If it's clear, you're doing great. Everything after that, it starts to let you know, hey, I need to add a little bit more water going on here. So there's, believe it or not, in India, they actually have these color charts in the bathrooms so people can tell, because it's so hot there all the time that people forget to drink. That's the other big thing, is a lot of people don't think about being thirsty. Like, I've actually gone through almost, probably 18 ounces of water here in our discussion. But a lot of people don't do that. They're not thinking that way. They're not thinking about drinking. And so that can be problematic as well. So it's surprising, but it has a huge, huge effect. For me personally, I came up with a formula. It's very simple. Take your weight, multiply it by 0.6. Okay. Then for every 30 minutes of exercise, add 12 ounces of water. That's it. That's the whole thing.
So weight in pounds.
Weight in pounds times
0.6.
0.6
Yeah.
plus 12 ounces for every 30 minutes of exercise. That's it. Once you do that, you are set. You are good to go. Your urine will probably be clear or faint yellow, and you'll probably be in good shape.
How do you feel about water filters? I know there's obviously many different types of water filters.
Nobody should be drinking unfiltered water. It's not actually good for you. Believe it or not, the water that's in our tap, there's actually something that came out of California not too recently where they're thinking about now getting rid of fluoride, which is could be a good idea because it turns out fluoride's not so good for you in your drinking water at all times. So you can actually get your water statistics of your area. There's a website that we give in the book. I can't remember off the top of my head, but you can actually get a water report on your water. And then you can see, and here's the thing that people don't know is in order to clean sewage, you have to use chemicals, and those chemicals leave residues in the water that's left over. And we drink that. And it's supposedly safe because it's so few parts per million that are in us. But we're now seeing nanoplastics are in every aspect of our body. I mean, we just saw, studies looking at testicles that have nanoplastics, brains that have nanoplastics.
Breast tissue as well,
Breast
isn't
tissue
it?
as well.
Babies born with plastics in them. It's crazy.
It's absolutely insane. And so what I tell people is filter your freaking water. Okay. Now, do you have to go cuckoo and crazy about it? No, you don't. Go buy a Brita filter, a nice pitcher. I would say if you can, avoid any water if you can in plastic containers, if at all possible. I like steel. It's just nice and easy. It's also easy to clean and it's fairly indestructible. And so I tell people all the time, just kind of stick with the filtered waters if you possibly can. You're going to be better off with it 9 times out of 10.
I did one of those things where you look up the water in your area. It's terrifying. After Darren Oline, who we were talking about earlier, the Darren Oline episode of the podcast, I'll link to that in the show notes, when he was like, go and filter your drinking water. And I went and looked it up and I was like, oh my God, like this, it just doesn't seem like if these pipes have been around for 80 years or longer, it just doesn't seem right that that there wouldn't be any little problems with that.
So it's fascinating. So I was actually listening to a podcast about this fairly recently, but now they finally have decided governmental wide to start removing the lead pipes. So when you go back to when some of these cities were built, lead was a very useful material to use. Chicago has thousands and thousands and thousands of lead pipes throughout all of its municipalities. So it's like now they're saying that you have to change out your lead pipes within the next 10 years because the microparticles of the lead pipe over the course of time are corroding, of course, getting into the drinking water. And now we're starting to see that. So it's an issue.
Yeah, like the great invention of asbestos.
Right, exactly. What could go wrong?
Breathing is another one of the things you talk about in your book. The average person takes 20,000 breaths per day, yet 9 out of 10 adults breathe incorrectly.
Yes.
How does breathing, something that's so automatic, impact our energy levels?
Well, it's pretty interesting, actually, when you think about it. So when I have somebody, like let's say that you are standing on a field, right? Just standing there and you look at your breathing. Your breathing is basically sustaining you standing upright, being alert and things like that. But if you had to get to the other side of that field very, very quickly, you would have to breathe very, very differently in order to do that. Breathing is fuel. Breathing is sending oxygen to glucose, which is the sugar in your body, and it sets it on fire, literally inside your body. And that's what gives you energy. So when you think about when you say, how does breath affect my energy? It is energy, right? So, but what we're doing in our bodies is we're always constantly looking at a balance. So with hydration, we're worried about the salt water balance, but with breathing, we're worried about the oxygen carbon dioxide balance at all times. And so when we think about breathing and breath work, there are so many different types of breathing out there. Like we were talking about earlier, 4-7-8 breathing is one of those breathing techniques that slows your heart rate down. There are other breathing techniques that will speed your heart rate up. Right? Hyperventilation, like Kundalini breathing and some of that type of meditation is all into the more hyperventilatory aspects of breathing, which brings you to a whole different type of breathing and breath work. So it's quite remarkable that something as simple as breathing can have such a wide spectrum of effects. Now, here's the thing that I found interesting is so many people breathe wrong. I'd say they've got bad breathing techniques or bad breath techniques. And it's quite interesting, but a lot of people are just super shallow breathers. They just And they don't even realize it. They're just not breathing at extended periods of time. And what ends up happening is, number one, your heart works harder. Number two, your lungs work harder. Number three, you don't get as much air, right? Because it has to suck it in and suck it out. But if you were doing some nice deep belly breaths, like, dude, just doing that right now felt really good.
Intentional breath makes a huge difference, especially when they're, what is it, tension myositis syndrome, TMS, when they talk about how stress and other inflammatory causes in your environment and your life can contribute to physical pain. That's been a big thing for me. I get back pain when I'm the most tired and the most stressed. It's the way it manifests in me physically.
Yes.
Doing a 5-minute or a 10-minute meditation or taking some intentional breath can alleviate that for me, that back pain. And that is one of the most incredible realizations that I've ever had in my entire life.
I mean, it's huge. And once you find that key that unlocks that thing for you, that becomes massive. And breathing is one of the many, many, many things that can do that for a lot of people. And they just don't realize it. I mean, just a big sigh, just a like that just feels good. You know, there's nothing wrong with doing something like that. Also, you get more air in, so everything becomes more efficient. Your body works, healthier, better.
Before we move into our version of the rocket round for this episode, is there anything about the book that you want to share to give us a bit of an overview of what that covers and how it can help people?
So here's the best part is if you get the book now, we actually send you the plan for free ahead of time. So before the book even comes out and is published. Also, the book is kind of like a ticket. You get to come to a couple of seminars with me where I'm giving live lectures. You can ask me questions, fun stuff like that. The book itself is really good. It's really simple. So the goal here was not to make you, oh my God, Michael's having me do 12 different things 12 times a day. Like, no. You set 5 alarms on your phone. That's it. At those 5 times, I have you do some very simple things and you're done. You would be shocked. Literally within 3 weeks, you will meet every hydration goal you ever had. And by the way, you don't have to do all 3 of them at the same time. You can do them one at a time. You can pick and choose. Let's say you feel like you got sleep covered. Then just focus on the hydration and the breathing section of the book. You'll be kind of choose your own adventure. It works really, really well that way. So I would say check it out. I think you'll really enjoy it.
Yeah, I had the opportunity to check out an advanced copy and it's an amazing read. So
thanks,
well done.
bro.
Like all your other books. You know I love all your books.
I appreciate it.
Well, let's now move into the rocket round.
Let's
so
do
rather
it.
than do the rocket round, I thought we could do this edition called Overrated or Underrated. If it's overrated, it means it's a biohack that's been hyped up way too much. We need to bring it back down a little bit. If it's underrated, it's something that's very effective and we need to make a bit more recognition for it. So you ready for this one?
Let's do it.
Number 1, mouth tape.
So I think it's overrated, but can be effective. So the big problem with mouth tape is people don't know how to use it. They go horizontal. It should not be. It should be vertical, number 1. You never want to go all the way across the mouth. Number 2, you should be screened for sleep apnea before you use mouth tape. Because if you have sleep apnea and you tape your mouth closed, it's going to be bad.
Oura ring.
So Oura ring, the best out of all of the trackers. But I would also tell you that, unfortunately, none of them are fantastic. Accuracy is an issue for almost all of the trackers. But instead of going for the finite data point, look for trends. So I don't care if you got 14 minutes of deep sleep, as long as it was 14 minutes every night. But if it goes from 14 to 600, I want to know what happened on that night.
Magnesium.
So we talked a lot about magnesium. It definitely has some real world appeal. And there's data now behind it that says it actually works. So I think it's underrated.
Sleeping pills.
Overrated for sure. I think the addiction component to them is what really throws you off there. I also think that a lot of people walk into them thinking, oh, I'm just going to take a couple pills and see how it works. And before they know it, it's 2 years later.
Melatonin.
Overrated for sure. People think it does stuff that it just doesn't do.
Sticking to a routine.
Underrated. It is by far the most important thing that if you want to win the day, stick to a freaking routine. I don't care which routine it is, but figure out your routine. And I think that really is fundamentally how you win the day.
Memory foam pillows.
So I'm not a fan. I think they're overrated. Here's the problem. They're hot in many cases. Also, if they're not at the correct height based on your sleep position, they can give you a crick in your neck.
Blackout curtains.
Overrated. Here's what I find is if you use blackout curtains and you have to wake up in the middle of the night to go to the restroom, you almost certainly fall over something and there's no sunlight in the morning. So I would say better to use a sleep mask than blackout curtains.
Weighted blankets.
Underrated. I think that they can be useful for some people. However, there's some cautions. Number one, if you have small animals or babies, make sure to put your weighted blanket away, because if a baby or like a chihuahua gets underneath there, it could be a problem.
NMN.
NMN. I think that is overrated. I'm not convinced that the data, at least in the sleep department, is really particularly worthwhile.
NAD.
The opposite. I think that is underrated. I think if you can have not precursors, but actually high, good quality NAD, I think that could be very beneficial. And I think if you were looking for like one big thing, that could probably be it.
Blue light glasses.
So blue light blocking glasses, you're not going to fix your insomnia with them. But if you do like to watch television to fall asleep at night, I don't think it's the worst thing in the world.
That's it. We got to do that more often. Overrated versus underrated. That's fun, isn't it?
I like it.
I learn a lot too.
Absolutely.
Well, there are a bunch of ways to connect with Dr. Michael Breus, and we'll link to all of these in the show notes. You can follow him on Instagram at The Sleep Doctor, visit his website and access all of the articles he mentioned at sleepdoctor.com, and grab a copy of his brand new book, Sleep, Drink, Breathe.
Please.
Again, all that and more will be linked in the show notes. What a pleasure, my friend. Thanks so much for coming on the show.
Always good to hang out with you. Thanks, bro.
Thanks for joining me on another episode of the Win the Day podcast. We want to hear your thoughts on what we covered today, so drop a comment on the YouTube version of this episode with your favorite takeaway, any questions you have, or what actions you'll be taking as a result of what was shared in this episode. And if you found value in the Win the Day podcast, leave a 5-star rating on Spotify and Apple Podcasts. You'll find a link to both of those in the show notes. It'll only take you a few seconds, and more ratings really helps other people discover the show so they can get the mindset upgrade they need, and we can bring more winners into the Win the Day movement. That's all for this episode. Get out there and win the day. Until next time, onwards and upwards, always.